Hi, I'm Sydney Pulaski, and my project is cystic fibrosis. Cystic fibrosis is characterized by defects that involve how the body transports chloride ions within and between cells. With cystic fibrosis, it is an autosomal recessive disorder, and it must inherit a defective gene from both parents in order for a patient to be diagnosed with cystic fibrosis. The defective gene is located on the long arm of chromosome 7 in the 7q22, 7q31. Most common mutation involved a 3 base pair deletion at codon 508 called delta F508. In the picture shown to the right, it shows a good representation of the gene mutations in cystic fibrosis. Phenotypic features. Age of onset newborn, but can vary with severity of disorder. Physical features of how this affects a patient is trouble breathing, infertility between men and women, and bacterial infections. This is a case study I had studied about a patient who was 12 years old, living in Egypt, but was originally born in England. He suffered from years of ongoing coughs, shortness of breath, wheezing, night sweats, and weight loss. He had gone to the doctor and had suspected asthma, and they gave him inhalers and all this stuff. But after being treated for his asthma, they realized that his cough wasn't getting any better. He went and got a chest x-ray and was later referred to a TB clinic. He was originally tested for TB, but tested negative to the matrix T-spot and sputum AFB, which would clearly show that a child would have cystic fibrosis. What the genetic issue was cough from childhood since birth. The disease was diagnosed after CT scan showed that there was a widespread of bronchiectasis showing mucus plugging. The sweat test displayed a high chloride level of 81, which displayed a possible diagnosis of cystic fibrosis. The patient also suffered from finger clubbing, which is very common for cystic fibrosis patients. The young boy was confirmed because of the 1040G mutation in exon 14B deletion present. After correct treatment, his coughing and lung function improved and his weight increased. The patient started regular pancreatic enzyme replacement therapy, fat-soluble vitamins, and nebulized DNase and prophylactic fluoxetine. Background of the disorder. So the molecular cause is the defective CFTR protein. CFTR stands for cystic fibrosis transmembrane conductance regulator. This protein is an ion pump located in the cell membrane that regulates the transport of sodium and chloride ions onto and out of the cell. Cystic fibrosis patients retain water within the cells, leading to the buildup of dry, sticky mucus. This affects 1 in every 3,900 newborns in the United States. About 30,000 Americans have cystic fibrosis, most common in people of Northern European descent, and it is estimated that 1 in 25 people of Northern European descent are carriers of a defective CF gene. Particular gene chromosome where mutation has occurred is located on the long arm of the chromosome 7 in the 7q22, 7q31 interval. This is most common and it involves a 3 base pair deletion at codon 508 called delta F508. Mutation in the DNA sequence leads to the production of a defective CFTR protein. There are more than 1,000 more mutations that cause CF. Here is the photos show the father and mother carrier and how it is descent to their children and who's affected and who is not. So a baby receives 1 copy of the gene from each parent, and the baby will have one of the 4 following combinations of the genes. Phenotype and natural history. Diagnosis. Often based on symptoms, family history, and screening tests. It can be confirmed with genetic testing and other lab tests that might be used to diagnose cystic fibrosis are sweat tests, analyzing the sweat for elevated levels of salt, and a transepithelial nasal potential difference measurement. Symptoms that cystic fibrosis patients present are salty sweat, a lasting cough, problems with breathing, poor growth, weight loss, and physical characteristics are associated with the buildup of sticky mucus in the tissues that clogs the air pathways, which builds up bacteria and causes infections. With the lungs, this is often seen as progressive deterioration. Difficulty breathing are more prone to suffer from bacterial infections of the lungs. Normal patients cough bacteria out. Cystic fibrosis patients are not able to do this because the mucus is too thick in their airways. The pancreas ducts are often blocked, causing tissue degeneration, scarring, and dysfunction. Pancreas normally produces and secretes different enzymes that are involved in the digestion of food. CF patients suffer from pancreatic enzyme insufficiency, which causes proteins and fats to be poorly digested and often lead to malnutrition. The sweat glands are often salty as a result of the defective CFTR protein. Normally function by reabsorbing sodium and chloride across the tissues that are not as permeable to water. This shows the mucus and airways between a young child and an adult. It causes sinus problems in the head, lowers down to salty sweat, and an enlarged heart, trouble breathing, gallstones. Management. This has to do with combating the buildup of mucus. Main goals of treatment in patients with CF are manage lung and sinus infections, keeping airways and lungs as clear as possible, and making dietary changes. Antibiotics are also given to cystic fibrosis patients. Mucolytic agents are prescribed as a way to break up the mucus in the lungs. Dornase alpha is also used to break down the excess DNA that is present in the mucus. This helps with airway clearance. Breathing exercises and percussion are used for physiotherapy. Administration of blows to the back and chest to loosen the mucus. This may require wearing a vest that has the ability to deliver high-frequency chest wall oscillation during nebulizer treatments. CFTR protein modulators are supposed to correct the malfunctions in the protein produced by the defective CFTR gene. Digestive assistance. Most CF patients take pancreatic enzymes with every meal. Eat a diet that is high in fat and protein and carbohydrates. Supplements and multivitamins are also given. Currently, there is no cure, but the disease is fatal. But life expectancy has expanded. Median age of survival stands at late 40s or 50s. In the future, the hope is that a form of gene therapy will be able to be used to insert a normal gene to replace the defective gene. Complications associated with treatments. Respiratory failure and the primary cause of death is in more than 90% of cystic fibrosis patients. Inheritance risk. Pattern of inheritance. Autosomal recessive must have 2 copies of defective gene to have cystic fibrosis. Risk of inheritance, where one parent carries one or more alleles. If both parents are carriers of a defective gene, there is a 25% chance that their offspring will have cystic fibrosis. This is how, again, another representation how a person could get cystic fibrosis. There's the 2 parents. When 2 people who are carriers have a child, there is a 25% chance of having a diseased child. Phylogenetic disease of the evolution. Being a carrier of CFG may confer some sort of survival advantage. Based on the fact that 1 in 20 people of European descent are carriers, this must be somewhat beneficial to be a carrier, otherwise the gene would tend to disappear over time. The mutation causes CF if 2 copies are present, but it may give resistance to cholera or other diseases that are associated with dehydration and diarrhea. Most common mutation leading to CF is F508del. Origin traced to 2 separate events. Cystic fibrosis was first introduced about 50,000 years ago to the European population, possibly through the Basques of Spain. Second introduction occurred with the beginning of agriculture in Europe about 10,000 years ago. Thank you for watching.